Hey guys, Dr. Scott here again. I'm not sure if this is the first video you guys are watching. I put these videos together for some of my college classes, especially since now, because of the coronavirus issue, we're doing a lot of classes, if not all the classes, on Google Meet. So there's certain things in anatomy, kinesiology, myology that I may not be able to demonstrate that I would do in a normal, typical classroom setting, that I'm trying to supplement some of the info. So if you haven't seen the other videos, I try to explain the same thing to them. Go back to those videos if it'll help you. This video, we're going to be talking about movement, basic things with movement. First thing was flexion, okay? Just basing it on the notes that I've given you. So flexion is moving the sagittal plane, decreasing the angle of a joint. Extension, which is the antagonist movement, is increasing the angle of the joint in the sagittal plane. Now remember, on the planes of the body video, I told you sagittal plane divides us into right and left halves, okay? So we put the sagittal plane, and movement around the sagittal plane is I put this pen in here as an axis, so we have movement forward and movement back. So if I take my elbow, most of you, even if you have never taken anatomy before, understand this is flexion of your elbow, extension, like you're lifting a barbell at the gym. So flexion is this, moving up, okay? Extension, moving down, okay? All right, so flexion, we're decreasing the angle of the joint. Extension, we're increasing the angle of the joint. So we're in the sagittal plane, okay? So I know that you're still looking at this in a one-dimensional video, okay? It's a little bit better in the classroom setting, but this is the best we can do right now. So flexion, go this way. Extension, we're kind of coming forward towards you, okay? So there's movement. So again, I'm trying to do it this way too. Flexion, extension. So flexion, extension. Next movement is AB and adduction, okay? So again, hopefully you're watching this, following along with your notes. That's abduction and adduction or adduction, okay? So it's moving in the frontal or coronal planes. Now remember, frontal coronal planes, as I dip down, we divide ourselves into an anterior and a posterior section, just like if I took this plane, cut ourselves through the body. So I'm putting it out in front of me. So what happens when I put the pen here? We only can get movement this way or this way. So abduction's movement from the median plane. So abduction's taking my arm out. Shoulder abduction is coming out away from the midline of the body. So I'd be doing this. Adduction would be going the other direction, moving towards the midline. So adding towards the median plane or the midline of the body, and abduction's moving away. So AD, adding towards the midline, adduction, abduction, okay, or abduction. Okay, we say AD because if I say it pretty quick, or most people say it pretty quick, it sounds the same. Okay, so AB and adduction. Then we do horizontal AB and adduction. Okay, now it sounds the same other than it has horizontal. So it's movement in the transverse plane. Now remember, the transverse plane is like the magic trick. So if you haven't watched the other video, I talk about the magic trick, that we divide ourselves in top and bottom. Magic trick being, typically there's a woman that's sitting in a box and the magician cuts her in half and then separates her. Okay, so I have it here, we're cutting ourselves top and bottom section. So I put it out in front, so now we're turning this way or this way. So what we're doing now is horizontal abduction. We begin at 90 degrees. So before we said regular abduction was this. Okay, first thing you do is get our arm into 90 degrees. Now, if you do this at home, I recommend, take a piece of paper, put a pencil right through the middle. First of all, we can agree that that's a 90-degree angle. Okay, so now what we're doing is we're moving from the midline of the body, but starting at the 90-degree angle. So this is horizontal abduction, and this is horizontal adduction, adding towards the midline, okay, of the body. So regular abduction, horizontal abduction. Horizontal adduction, regular, I'm coming off the screen here, but regular adduction, okay, adding towards the body, okay. So again, hopefully this is a little bit helpful for you, since you can't, I'm going to try to explain it in class and try to go, while we're doing it online, and I'm probably going to try to have you do it while you're sitting in front of your computers too. Then there's internal or medial rotation and external or lateral rotation. We typically talk about that into the shoulder or the hip. Okay, so it's movement in the transverse plane, which takes the body part outward. So with shoulder, I'm going to put my pen down here for a second. So shoulder, and I'm bringing my arms up a little bit just so you can see. I realize, again, I'm not using great technology. I don't have a camera person. So external rotation, we're going to look at my shoulder. Basically, as I bring my palm forward. Now, don't confuse it. We're going to talk about pronation, supination in a minute. Okay, but our shoulder externally rotates or internally rotates. Sometimes we have our arms here. If you've ever been to physical therapy, sometimes they'll have bands. This is internal rotation and external rotation of the shoulder. Sometimes we lay on our back. This would be internal rotation. This would be external rotation. A picture. Okay, one of the pictures I believe I use in my slides, when he's cocking his arm back, that's external rotation, internal rotation. Okay, but keep in mind, I'm not going to try to do the hip one on camera here because I may fall over, but you know, we do it in 3 different planes. But external is also called lateral rotation. Internal is also called medial rotation. Many people interchange that terminology. You should try to learn it both ways. People sometimes aren't trying to trick you. I'm not trying to trick you, but there are reasons why, you know, we want you to learn it that way so you're never taken off guard, okay? So internal rotation, external rotation. Hopefully one day I can do a video, I'll show you in the hip, but the same thing applies. I'm just gonna move my paper here for a second. There's circumduction, okay? It's a combination of flexion, extension, ab and abduction, okay? So in our shoulder, okay, if we do circumduction, think of circles, right? 360 degrees. Okay, if you're a swimmer, butterfly, okay, if you think about it, all right, I showed you elbow flexion. Shoulder flexion is this. Shoulder extension is coming back. If we combine that with the AB and adduction I just showed you, okay, so we're going abduction, flexion, okay, then we're doing starting to go into extension and adducting, and you kind of add that, you get circles. Then there's supination and pronation, all right? In Myo 2, we'll talk about pronation, supination at the subtalar joint at the ankle, okay? But in this class, we mainly talk about the forearm. So I said, right, this is what? Anatomical position, all right? Anatomical position, we have our elbow and our forearm in a supinated position, palms up. Pronation, palms face downward, okay? Pronation, supination, pronation, supination. Okay, inversion, eversion is going to be a little bit more difficult. I may do a separate video on the lower extremity, okay? But if this is my ankle, this is the outside of your ankle. So right now, if you're watching this, if you feel the outside of your ankle, that's out here. Inversion is the soles going towards the midline of the body. Eversion is the soles going outward, okay? Sorry, I can't show you that right now. I don't have a camera person, but inversion ankle sprains are the most common, about 80%. All right, we stress the outside part of the ankle. So if you have your ankle right now and you bend it so your sole of your foot is more facing towards the median plane, right, the midline of the body, and you feel a stretch on the outside part of your ankle, right, the lateral part of your ankle, the outside, that's inversion. Eversion feels more difficult to do because the motion doesn't occur as easily. That's going to stress the inside part of the ankle. That's called an eversion ankle sprain when we get to kinesiology. Okay, you're trying to bring your sole facing outside now, and you'll feel a little bit of a pull or tension in the tissue. So that's eversion. Then there's plantar flexion and dorsiflexion at the ankle. Plantar flexion with your ankles like hitting the gas pedal, right? All right, so if I turn this way, hitting the gas pedal, okay, is plantar flexion. Dorsiflexion is bringing your toes and heads up to here. So again, don't worry, I'm just showing you on my wrist, okay? Plantar flexion, dorsiflexion is at the ankle joint, not at the wrist, okay? Couple other motions, okay, is lateral flexion. We usually talk about it in the trunk, and we usually name the lateral flexion based upon what side you're going to. So this is the right side of my body. Again, this is my left, remember, anatomical position. So head, neck, and trunk. So this is my right, going to right lateral flexion of the neck, left lateral flexion of the neck. Again, we'll learn it as cervical spine when we get to that unit this semester. Right lateral flexion of the thoracic and lumbar spine, left lateral flexion. okay? Rotation, same thing. Right rotation usually occurs in the spine. Right rotation, left rotation. Right rotation of my trunk, left rotation. So don't confuse. This is right lateral flexion of the neck, and then this is right rotation when you're looking back over your shoulder. Protraction, retraction. I'm going to turn my body here. If you're in the gym, you ever do seated rows, okay? First of all, when you come forward, almost like you're going to punch someone, we're protracting, drawing your shoulders forward. You're doing a seated row at the gym. The weight's coming forward. When you retract, you bring your shoulder blades back, almost like they're touching each other. Okay, so protraction, retraction. So those are the main body movements of the body that we're going to be talking about. When we get to each area in Myo 1, Myo 2 kinesiology, we'll break it down further. But I want to give you a few examples. Okay, I said this was flexion, extension of the elbow. This is flexion and extension of the shoulder. Okay, anatomical position, right? This is flexion of the wrist, extension of the wrist. If I turn it over, like I'm riding a motorcycle, right? Extension, flexion of the wrist. Flexion of the fingers, making a fist, extension. Okay, I'm not going to be able to show you the lower extremity in this video. Trunk flexion, if I come forward like I'm going to touch my toes, right? Extension, going a little hyperextension, right? That's extension of my trunk. We said AB and adduction. We just showed you all the internal, external rotations. So I think that's a nice video for you to at least see these motions. Thankfully, you have YouTube. You can type them in. You can probably get a lot of other videos more sophisticated than mine, but at least you get to see it the first time here. Okay, hopefully that helps, guys. Have a good day.